came to you and I had just been to the gynecologist for my annual, literally 6 months before, had a pelvic exam, pap smear, everything. Tell me what pap smears screen for.
Pap smear screened for pre-malignant or precancerous changes on the cervix, the lower part of the uterus. It can also detect the same kind of changes in the vaginal area, but primarily it's meant to screen the cervix for precancerous changes that may lead to invasive cancer of the cervix. It can also detect invasive cancer, but most of the time it's the pre-invasive disease that the pap smears are picking up.
So we're not screening for ovarian cancer when we get a pap smear, to be clear, but it's still important.
No, it's still important, but no, we're not, because the ovaries are inside the abdomen. The cervix is really exterior to the abdomen. So there's no way a pap smear could pick that up.
I remember one time, I think it was you. I've had a lot of pelvic exams, so my memory is not crystal.
Don't brag about it.
But, well, it's just a fact.
Right.
But I remember one time, like, I think it was you, and I was like, when I had somebody tell me once that like they could feel your ovaries from a pelvic exam, and you were like, well, they're lying to you. I think that was you.
That was probably not totally true, but it's sometimes very hard to feel the ovaries when you're doing a pelvic exam. Obviously, when they're larger, they're easier to feel, but just because the ovaries not large doesn't mean that you don't have a problem, that you don't have a cancer, because all cancers don't just cause the ovary to get large and then to spread from the ovary. It can spread early and be in the abdomen where the ovary itself looks pretty normal.
So that's why I guess when we're talking about early detection, which we'll get into in a second, but if you were able to feel something crazy going on with the ovary during a pelvic exam, that would not most likely be getting you early detection, because it would have to be significant, correct?
Well, that is for the most part correct, yes. There are changes in the ovary that, like germ cell tumors that I spoke about earlier, or even the stromal tumors of the ovary, that is the connective tissue in the ovary, that can cause the ovaries to be enlarged but not spread, and they stay contained in the ovary. So a lot of times those varieties of ovarian cancer are picked up earlier because they haven't spread. The predilection is not for them to spread early, like the other ovarian cancers we're talking about.
Yes.
So that really is what is the problem with identifying something that we can use to screen for ovarian cancer, because the blood tests that we use to follow women with ovarian cancer are not necessarily good at picking up the cancers early, and the exams, like you said, are so in terms of identifying a problem in the pelvic area or around the ovaries, that it's very difficult to diagnose those early.